We live in an increasingly urban and populated world. 60 years ago, 2/3 of us lived in rural areas, while by 2050, the opposite will be true. Roughly 2 out of 3 will be concentrated in urban areas. Over 6 billion people living and working in the planet's cities. This dramatic shift brings enormous public health challenges, including outbreaks of serious, even deadly, mosquito-borne illnesses. The current Zika virus outbreak in the Americas demonstrates how growing urbanization and travel increase exposure to Aedes aegypti and Aedes albopictus, container-breeding mosquitoes, and the viruses they transmit, such as dengue, Zika, chikungunya, and yellow fever. While many common mosquitoes are active at dusk, these species do their biting by day. They thrive in urban environments that furnish them with natural and man-made containers, ideal habitats for egg-laying. Since these sites can be small, hidden, and difficult to find, controlling container mosquitoes can be a significant challenge that requires a unique, prescriptive approach. Fortunately, these challenges have recently spurred health officials to conduct groundbreaking work that shows that if we combine a clear understanding of the vector biology and proven targeted solutions, we can control these mosquitoes and dramatically limit the transmission of diseases. For example, in Kandal Province, Cambodia, public and private health officials took a new approach to managing endemic dengue, with direct application of a biorational larvicide on a large scale. To monitor effectiveness, results from treated districts were compared with untreated districts. Human dengue cases fell by 43% in treated areas. In those left untreated, dengue cases increased by 395%. In Malaysia, health officials achieved similarly effective results with large-scale, wide-area, ground-based larviciding for Aedes aegypti control. 10 hectares were treated with just adulticide, while 8 hectares were treated with both larvicide and adulticide. The result? 15 new dengue cases were found in the area treated with just the adulticide, while only 1 new case was found in the area treated with both larvicide and adulticide. In 2009, the Florida Keys saw the first reported cases of locally acquired dengue in 75 years. Using an innovative application approach, health officials redesigned their integrated container breeding mosquito control program to include the world's first wide-area aerial larviciding application against Aedes aegypti. Since the implementation of the redesigned program, 0 locally acquired dengue cases have been reported. We know the Zika virus is transmitted by the same mosquitoes as dengue. Studies show we can effectively protect people against container breeding mosquitoes and the diseases they can transmit. Using new, data-driven operational methods, public health officials have the ability to integrate optimized formulations of highly specific biological larvicides into their programs, either through direct or wide-area applications, and we can easily monitor the results. There's still much to learn about the Zika virus, but we have both the science and the tools to manage and mitigate future outbreaks of mosquito-transmitted diseases like Zika in the Americas and beyond.